Hello, my name is Arya Javidan, and I'm the project manager for the National Consortium of Telehealth Resource Centers. Welcome to the latest presentation in the NCTRC webinar series. Today's session is on the Crystal Ball Project, Telehealth Technology in 3 to 5 years, and is hosted by the National Telehealth Technology Assessment Center. These webinars are designed to provide timely information and demonstrations to support and guide the development of your telehealth programs. Just to provide a little bit of background on the consortium located throughout the country, there are 12 regional telehealth resource centers and 2 national, one focused on telehealth policy and the other on telehealth technology. Each serve as focal points for advancing the effective use of telehealth and supporting access to telehealth services in rural and underserved communities. Just a few tips before we get started today. Your audio has been muted. Please use the Q&A function of the Zoom platform to ask questions. Questions will be answered at the end of the presentation. Please also note that closed captioning is available, and that's located at the bottom of your screen. Today's webinar is also being recorded, and you will be able to access today's and past webinars on the NCTRC YouTube channel. With that, I will pass it over to Jordan Berg, Director of TTAC. Jordan?
Thanks, Arya. So really pleased to be with you here today and to be able to talk a little bit about the Crystal Ball Project. This is actually the first time that we're getting to talk about this. And so we have a lot to go over, and we're going to be moving at a pretty rapid rate here. But like Arya said, I'm Jordan Berg. I'm the principal investigator for the Telehealth Technology Assessment Center. We're one of the 2 national telehealth resource centers. And again, we're here to talk about our Crystal Ball project, which has been in process for the last since 2021. And we're going to talk to you about some of the things that we've learned through that project and kind of provide you with some information and resources. But first, we should talk a little bit about who TTAC is. So like I said, we're the National Telehealth Resource Center that's focused on telehealth technology. We are federally funded through the Office for the Advancement of Telehealth. We provide technology assessment services to the 12 regional telehealth resource centers, as well as the other National Telehealth Resource Center. And we also work directly with individuals and organizations who are looking to make good telehealth technology decisions and to learn more about telehealth technology. Like Arya had mentioned, we are part of the National Consortium of Telehealth Resource Centers, and his map was better, so we're going to skip this slide here real quick. So what does TTAC do? So to quote one of my favorite Liam Neeson movies, we have a particular set of skills, and that skill is around the assessment and kind of presentation of telehealth technologies. These are a few of the different technologies that we've looked at in the last 3 months here. We love to bring in new telehealth technology to learn about it, to be able to talk about it and help people create their own assessments and learn more about telehealth technology as it applies to their organizations. So what are we talking about today? So this is just a little overview of what we're going to cover. We're going to talk about what the Crystal Ball Project is, kind of how it's structured, what some of the deliverables are, some of the limitations of the project. We're going to talk about the 6 future technology areas that the Crystal Ball Project decided to feature, and then go into each of those at a really, really high level. And I say really, really high level because each of these topics is probably worthy of a webinar in and of itself. And on that note, I wanted to do a quick poll here. And we're going to do 2 polls, one here at the beginning and then one a little closer to the end as we're wrapping up. So Arya is going to put that up. So these are the different telehealth technology, and we say 6, and I know there's 7 things on the list, and we'll talk about why that is. But of the different technologies that are listed here, AI machine learning, expanded use of telehealth applications, apps and solution platforms, virtual and augmented reality, drones, robotics, and hearables, which of these is of the most interest to you? Which would you like to see more webinars on? Which would you like to see more content on in the future? Again, we're moving at a rapid clip today. We're going to hit all of these at a very high level, just skim the surface, but we wanted to kind of provide you with a lay of the land. So if you want to go ahead and fill out that poll, let me know kind of what you think. We can look at that result here real quick. And then after we go through each of the different topics at a very high level, we'll wrap things up, do conclusion, and have some time for questions. Arya, can we put the results of that poll up? All right, so makes sense. We're here with the National Telehealth Resource Centers. There's a lot of interest in use of the expanded use of telehealth, and so we'll talk a little bit about that today. And maybe that's something that we need to develop or to do a whole webinar for in the future. So what was the Crystal Ball project and what were we trying to accomplish with it? This really requires a little bit of background into how the Telehealth Technology Assessment Centers identifies and reviews the different technologies that we look at. And as we were there's a few different ways that we bring in information. One of the primary ones that we do is our telehealth technology survey. And this is a survey that we do every 2 years. We're actually due to do one in the beginning of next year, where we reach out and we ask anyone that we can really get to fill out the survey, what they're using, what they plan to use, what some of the challenges that they have are, what technologies are interesting to them. So that's one of the ways that we look at what technologies out there. Another way that we do it is through market reviews, and we do through web research, looking at the different spec sheets and things that are provided by manufacturers, bringing in technologies, doing assessments on technologies. We also look at what's the requests that we receive from our technical assistance requests from users and TRCs and different stakeholders we have across the country. So the problem with all of this is that we are looking either at current state or we're looking at past state. We're looking at what exists instead of kind of looking ahead and seeing what's around the corner. So what we were thinking and when we wanted to begin the Crystal Ball project is, what if we took a little longer view? What if we, instead of looking at what currently exists, what's on the market, what if we started to think about what's going to happen in 3 to 5 years in the telehealth space? And so instead of looking in the rear view, we wanted to look around the corner. What's next? What's in the near view? And I love a good pun, and that's the pun for today. No more. So this was our opportunity to look at what trends we were seeing, bring together an expert panel of different stakeholders that were in the telehealth market space and say, what do you think telehealth is going to look like in the next 3 to 5 years? So our objective was, we want to examine what digital health technologies and applications will be of most impact in the next 3 to 5 years. We want to provide credible explanations and examples of what those technologies are, and provide this in an readable, usable format for consumption by the telehealth community. So what did this look like? Well, we conducted bi-monthly meetings, and by that I mean we had 2 meetings per month between from April to December of 2021 and then into 2022. We had a group of panel experts where we brought together, and this was under the previous director, Doris Barta, who was leading TTAC at that time, and was coordinated and led by Mark Vanderwerf, who is really a key expert in the telehealth field. We had 11 key authors that we worked with, and then nearly 20 contributing participants who we, from a variety of different aspects of the telehealth market space. So this included folks that were an expert in telemedicine, digital health, hospital administrators, consumer services and products, CEOs, entrepreneurs, chronic disease management, experts in technology and how it's used with the elderly, and then telehealth technology in general. So in these meetings, we had a couple things that we were trying to do. One, we wanted to identify what are the key technology areas that we want to consider as we move in the next 3 to 5 years. We wanted to define what those areas were. We wanted to describe the key attributes of those areas. We wanted to make a list of the potential applications and challenges that we thought might be coming around the corner as we gazed into our crystal ball. We wanted to provide examples of technologies that either were or were emerging in those market space. We wanted to compare what the current state of that market space was to a potential future state. And then we wanted to provide kind of easily digestible key considerations for each of these topics. All of this would be kind of put together and created into a crystal ball toolkit document that would be available. And that is actually being published in the next 2 weeks here. And actually brings us to our deliverables. So the toolkit will be available in 2 weeks here on the telehealthtechnology.org website, where we go into a lot more depth on each of these topics. And then we have a planned webinar series that we're working on, kind of figuring out which ones of these topics that we want to address first. And then we'll be providing webinars around each of the telehealth technology trend topics that we have. We do want to talk a little bit about some of the disclaimers that we had. We call this the Crystal Ball Project, and that's really good and kind of apt. We are trying to guess what the future is going to be. It's an educated guess, and it's we had probably the smartest group of telehealth experts that I've seen in kind of one space, really thinking about this and diving into it. But it's impossible to look around corners. And there's a couple examples of why that's impossible that happened right as we were diving into this. We began this project kind of at the beginning of COVID, and that really changed the landscape. We've also seen a few of the technologies that we've looked at kind of leap forward past what we were kind of predicting at the time. And then we've had some that have kind of stalled out and kind of dragged a little bit. So, you know, in summary, we are taking our best guess at what's coming up, but you can't look around corners. We can't really predict the future. We can just make an educated guess. And then the other thing that we like to point out is TTAC is a vendor neutral, so we don't endorse or recommend or support any particular vendor or technology, but we do list some technologies in the toolkit, and we'll talk about a few here today that are listed as examples of the types of technologies that we think are going to be changing things in the future. So what are the future technology areas? So the group initially found 6 future technology areas. And for those of you that are quick at counting, you'll say, but Jordan, there's 7 things on this list. So when we started this project, AI and machine learning, we knew that that was important, and we knew that it was going to be threaded through each of these different topics. So we didn't call that out as a whole separate topic, but as we got further and further into actually writing and kind of combining all the content together for the toolkit, we realized that it really needed its own topic area. But the idea here is that each of the other 6 areas, expanded telehealth application, apps and solution platforms, virtual and augmented reality, drones, robotics, and hearables, those are all affected by AI machine learning, and it's threaded through each of these different topics at a very high level. So let's dive into, and again, this is going to be kind of skimming the surface for each of these, but let's dive into some of the predictions that the group had for what we would be seeing from these technologies in the next 3 to 5 years. So the first one that we have is AI and machine learning. And so there's a lot of different kind of topics that are kind of bundled in together with this. But what we really are looking at is the use of learning machines that can learn, machines that are given inputs, and then through a learning process are able to create outputs and create valuable data for us that we can use to make decisions. So this might be artificial intelligence, machine learning, natural language processing, image processing. There's a variety of different topics that are kind of bundled into this group. We've seen the use of AI in healthcare accelerate over the last even 20 years. This is something that's been that long in the process. We find that within the last 2 years or within the last even year or 6 months, we've been seeing more and more use in applications accelerating rapidly. And I like the illustration that we have here, because AI's reach and use is actually reaching into every single aspect of digital life that we have and we're currently working with. But what are the predictions for how AI and machine learning are going to be changing the healthcare and the telehealth landscape? Well, the group found that AI the primary benefits for AI in healthcare were around personalized and targeted medicine, the ability to increase treatment precision and targeted care based on individual data that we're able to provide to machine learning algorithms. The second was in differential diagnosis and treatment planning. So using AI to help diagnose and make recommendations for treatment plans that providers could follow. That was one of the key areas. One of the ones that when we started working on this, that we've actually seen grow, and actually a lot of the industry has kind of become more familiar and actually using these tools now, are around the workflow and revenue cycle optimization. We're already seeing industry-wide benefits in how AI is able to handle issues with billing and coding, documentation, really increasing the efficiency of the different workflows that organizations are using. AI and machine learning are really good at image and text analysis. So these are some of the things that we're seeing. A few of the key things that this can do is identifying cardiovascular abnormalities, detecting fractures and musculoskeletal injuries in radiology, aiding in the diagnosis of neurological diseases, screening for common cancers and blood pathologies, screening for retinal imaging, dermatology screening and recommendations, and then improvements in medical note-taking and dictation. These are all areas that we think are going to be changed by artificial intelligence, machine learning, and are being changed kind of even as we speak. One of the things that we talked a lot about it with our group, and we kind of dived into, was the potential for AI to really provide us with different ways to approach healthcare and medicine, and to think differently than people think. The way that artificial intelligence pulls together information and processes information is really different than the human brain works, even though it's kind of built around similar concepts. And we see this reflected in some of the other things that AI has been doing kind of recently. So for example, the way that an artificial intelligence might approach even a game like Go or chess, they find strategies and solutions that human opponents have not considered before, that may not look like something that would make a lot of sense. But because they are able to think so many moves ahead, because they're able to process so much raw data, there are ways to treat patients, there are ways to consider how to treat patients that we've not even considered yet, that AI will be able to show to us, and that we'll be able to use. Indicators that we've not considered, drug applications that have not even been thought of yet, that AI will be able to show to us. AI has a lot of potential issues and considerations that we need to look at. Number one is the quality and the size of data sets. AI only really becomes functional when you have very large data sets that you can train your algorithms on. Those data sets have to be really pretty clean, and they have to be really well documented and really well keyed, so that we know kind of what we're getting. There's a programming term called garbage in, garbage out. If our data isn't good going in, it's going to give us results that are skewed when it comes out. And that brings us to the second is, even in these larger clean data sets, there've been notes of biases in these data sets, and a lot of times those biases are just ones that are reflected in general society. The way that we collect and the way that we interpret data just in general is impacted by our human biases, and then we actually program those biases into artificial intelligence and machine learning algorithms. Another concern that we have is around AI is just used as a buzzword for a lot of different technologies, whether that's just general algorithms, branching trees that used some basic programming to kind of help guide decisions, whether that's chatbots that kind of simulate a human experience but aren't really powered by artificial intelligence or machine learning technology. So a lot of times when the word AI is used, we want to make sure, what are we talking about? Are we talking about neural network algorithms that are processing data, or are we talking about things that kind of simulate a human experience? So AI is kind of gets thrown around a lot, but there's a lot of different types of applications and different ways we want to think about it. Another concern around artificial intelligence, machine learning, is we call it the black box problem. And what that means is that when we train these neural networks, when we train these artificial intelligent algorithms, we provide them with input, but there's very little insight into how these algorithms are coming to their conclusions. When you program an AI algorithm, what you're doing is you're basically saying, hey, these are all the inputs I'm giving you. This is the expected result that I have. And then we're tweaking a bunch of parameters in the middle until we get that desired result. And that tweaking happens in so many iterations and at such a rapid pace, it's almost impossible to know how an AI is arriving at the decision that it's arriving at. So debugging or finding, how these processes work is pretty much impossible. It's a black box. We're providing inputs, we're getting outputs. How those outputs are generated, it becomes really challenging to tell. And another thing to think about is, AI is a form of automation. So we are able to automate more and more complex procedures to artificial intelligent algorithms. And that's going to have an impact on jobs and workflows. And particularly in the short term, in administrative functions and in kind of workflows. But more and more complex and more specialized jobs are going to be impacted as we kind of move further. And there's been a lot of discussion about that. I've linked two kind of interesting articles here on AI and how it's being used to kind of support behavioral health screenings. These are things that we've kind of been doing some research on just recently here at TTAC. There's been a lot of effort to turn AI loose on social media output to diagnose depression and things like that. It's a lot of really, really interesting applications that are growing. And, this is, again, not going to just change healthcare, but it's going to change kind of every aspect of our digital lives and something that we want to watch. The second topic that we discussed within the group was the expanded use of telehealth and telemedicine. This kind of hit right as COVID was really ramping up, and we were actually able to see this kind of happen around us. But the predictions were that there would be continued growth in telemedicine and in home monitoring. That we would see increased quantity and relevance in patient-generated data, that the patient would actually be the source of data generated from their homes, generated from their devices that they have around them in their everyday life, their mobile devices, the things that they wore, things like that. We believe that it would be a key tool to improve access and equity for patients, that being able to provide telehealth to more people in more locations provides a greater level of access, and would that would be a key element of telemedicine moving forward. There was a predicted trend that primary care would adopt more virtual first care models, looking to use telemedicine as kind of that first point of interaction with patients in a lot of different models. There would be an increase in a lot of the on-demand care that was being done via telemedicine. And then there was a lot of discussion around how telemedicine would provide some basic core benefits to to every small rural hospital, and that as telemedicine in the next 3 to 5 years became more and more integrated into how we do healthcare, that every small hospital would have access to tele-ICU, telestroke, telemental health in the emergency department. And then the last prediction was that hospital to home would become the next growing space in telehealth and telemedicine applications. Again, we're moving pretty quickly here, but we're going to kind of keep going. We have a lot of, we could talk about this at a lot more depth, but this is kind of the high level overview. The third topic that we kind of tackled was around solutions and platforms, and how this differs from the telehealth and telemedicine applications is, this is really a lot more focused on the endpoints that we will kind of see in the next 3 to 5 years for telehealth and telemedicine. So applications, we live in an app-based society, and so more and more applications are being used. In applications, the two spaces that we saw the potential for the most growth were around decision support tools for providers and the use of chatbot technologies for patient engagement and for decision support tools. So the decision support tools for providers include AI-based tools that provide access to provide on-demand access to research, treatment protocols, and processes. We're seeing these begin to hit the market space, but we think that this is an area of that potential area for a large amount of growth. And we also see the potential use for AI-based tools that allow non-physicians and allied health professionals to treat more complex issues, to really operate at the top of their license or operate at the top of their capabilities as support professionals. Chatbots, we see these as really important tools for triaging the patient to the right care provider. A lot of times our systems are kind of dealing with patients that arrive and they're not really sure where to go. And a lot of times our providers may not entirely be sure where to send them. So using this chatbot technology, using either AI or basic decision tree, we can get the right patient to the right provider at the right time. We think that's an area of growth. We think that more and more of these solutions are going to be integrated into the electronic health record. We're seeing currently a lot of automation for administrative functions, and we think that more and more EHR solutions are going to have automated check-ins, automated vitals collections, and automated processes for coding and billing. And again, as we've kind of talked about, the coding and billing piece of this is already happening, but we've been looking into a lot of the different ways that these processes could be automated. We've really seen some, TTAC has seen some really interesting technology around vitals collection, where vitals are able to be obtained just from a basic webcam or from solutions where, without touching the patient, we're able to collect temperature and heart rate and pulse. And blood pressure just from a camera, instead of actually having to hook the patients up to a blood pressure cuff or a pulse oximeter. So these are things that we think are going to be automated through the EHR, and that EHRs will have kind of built-in processes for doing these in the next 3 to 5 years. We've also seen a lot of movement in the BioWare biosensors. This was a point of a lot of conversation within the group. We think remote monitoring, the tools, not just for chronic care, but for really almost any disease state, we think there's going to be a lot more monitoring tools that are available to patients, either through their mobile device or through kits that are sent out. Wearable technologies like smartwatches, rings, things like that, they're becoming more and more robust. The biometrics data that they can gather is becoming a lot more valuable, and what to do with those data sets is becoming a topic that we really need to tackle in the next 3 to 5 years. The AI through line on this one is that AI is able to crunch those large sets of data and able to create trend analysis from that data that we will need to kind of make sure we have a plan for as we kind of go forward. So AI is able to see trends and to be able to draw conclusions from disparate sets of data that we can't even consider quite yet. The next topic that we were looking at was around augmented and virtual reality. And I apologize a little bit for this slide. I had a slide and then I went to look this morning and it wasn't there. So, but this is a key and kind of one of our favorite topics here at TTAC. But the Crystal Ball Group took a look at this and said, the way that virtual reality and augmented reality are being rolled out in society has primarily been around entertainment, has primarily been around kind of a social interaction device. But we really do see applications primarily in training for healthcare professionals. There is a lot of money every year that's spent on training facilities. There's a lot of money that's spent on continuing education for providers. By using augmented reality and virtual reality, the group found that there was a lot of potential to standardize the training procedures that were happening, provide less costly solutions to actually get the training into the hands of the people that need it, and to provide not just provider education, but patient education. One of the real advantages of augmented reality and virtual reality is its immersive nature. And for those, that learn not just from reading or from listening, but from interacting and doing, it's a really effective way to learn. So we think augmented reality and virtual reality is really key for training the next generation of healthcare providers. We've also seen a lot of applications for AR and VR in mental health and opioid recovery. We think that this is one of the key things, again, due to that immersive nature of the technology, due to the ability to get it and to get high quality out to all these locations for patient education, for family education, for community education, being able to use these things. Virtual and VR and augmented reality, they're going to provide a lot of solutions around surgical planning, creating models, being able to visualize the structures. We're already seeing this used a lot for training for anatomical purposes. Instead of 2D anatomy guides, we're actually able to create plans for surgeries in 3D, show where we're going to be annotate on these 3D models what we want to do, and be able to describe that to other providers and to patients. And these are the changes that we think AR and VR will have in the next 3 to 5 years. Drone technology is one of the key ones that we're looking at as well. Drones are being primarily driven, the technology being primarily driven from the consumer product of deliveries. We think that these consumer products and service will cause greater integration of these technologies into our system. One of the big challenges around this technology is around the regulatory concerns, particularly here in the United States, getting these integrated into the FAA system so that we can actually use this technology kind of in urban environments, around infrastructure, making sure that they're safe. Consumer use of these devices for consumer products is kind of what's driving that. And we think that in the long term, that's really what's going to make these kind of integrated into our society. The other big driver in this space, at least as far as the US is concerned, is around the US military. There's a lot of drone use for healthcare in the US military. Considerations for projects that will actually be used to transport casualties from the battlefield using drones, and actually being able to deliver a suite of life-saving interventions in that drone as it transports the casualty from the battlefield. Logistics around getting the supplies and materials needed to forward operating areas to actually deliver care, including emergency supplies like blood and plasma and all those resources. The US military has a lot of active projects around drone use in healthcare, and we think that those technologies, as a lot of these tend to, will trickle into the general healthcare market. The US in most healthcare aspects is a little bit behind the curve in terms of drone use. We've actually seen successful pilots for the use of defibrillator drones that can actually be dispatched to patient locations where they're having an out-of-hospital cardiac arrest. We've seen successful pilot uses of this out of Sweden, and then there are projects that are being considered in the United States, but this sort of rapid response, getting key equipment out to locations is a a great example of how drones will be probably used in the next 3 to 5 years. We're also seeing for particularly rural and underserved medical communities, the ability to use drones, particularly fixed-wing drones for delivery of critical medical supplies is something that we've seen out of Africa and other countries outside of the US. So we've had several examples of organizations, including programs out of Africa that use fixed-wing drones to deliver vital supplies and medical rapidly and very cost-effectively. You can see from the image there, there's the fixed-wing drones, and they're able to drop blood, serum, vaccinations, and not have to have them refrigerated because they're able to get them out to the locations so rapidly. Again, the delays around use of this in the United States are primarily around how do we integrate these technologies into our really robust and really safe FAA infrastructure. How do we make sure that we're able to use these in urban locations around infrastructure and make sure that they're not going to interfere with the other activities that are happening. So we believe that the US will catch up, but probably when we will catch up, it will probably be beyond the 5 years that our drone use will continue to lag behind some of the other places in the world, but that we will catch up once our regulatory concerns and have been addressed. Another key topic that was identified by the Crystal Ball group is around robotics. Robotics, a little bit like AI, there's a lot of potential applications, and we can be talking about a lot of different things. But robotics are generally machines that do things that humans are either incapable of or that are or capable of doing, but provide a lot of wear and tear on the human being. So repetitive tasks, finely detailed tasks, things like that. We've seen a lot of increase and the potential for increase around prosthetics. So creating robotic prosthetics that are able to provide greater range of motion, greater dexterity, greater fine motor skills. We've also seen robotics or an area for growth is around physical therapy, where robotic tools can provide a more accurate, a better, a more standardized approach to physical therapy interventions than in many circumstances. We've really seen a lot of robotics used in surgical applications, whether that's guided surgical applications where you actually have a surgeon that is guiding the use of robotic hands or robotic tools. And we think in the next 3 to 5 years, we'll see a lot more of those procedures actually automated where there will be less input needed from an actual surgeon, and that these devices will actually be able to do more and more of these procedures with greater autonomy. One of the growing areas for robotic use is in the patient home, either as assistive or companion robots. So these are tools that can go into the patient's home. It can be anything from a robotic coffee table that's able to move across the room and move things closer to where a user needs to use them. Companion robots that can check in on people living at home just to make sure that that they have the things that they need, alert if they notice anything that's out of range for that particular patient, and then provide things like medications or be able to do light tasks around the house. So this is where we think we'll see a lot more robotics in the near future, well beyond kind of what we're seeing from the robotic vacuum cleaners that we have today, able to do a lot more tasks and provide a lot more interactions with patients in their home. Another aspect of robotics that we think is going to grow and be a substantial impact on the healthcare is around 3D printing, particularly for rural communities. We think 3D printing is a really large growth area. not only just printing tools and things like that, which they can do, but printing custom orthotics, printing dental implants, printing critical parts for things that might break down. 3D printing is one of the things that we are, one of the areas that we're looking, particularly for rural communities that need these things just in time. This is another one of the areas that we have seen that have kind of grown out of some of the technologies we've seen in the US military as well. Being able to put 3D printed resources closer and closer to the places that they need. You don't need a lot of your really common items, but when you have a specialty thing that breaks down, being able to print your own and get that out and make sure that those functions keep happening, that's the area of growth for those 3D printing. The final aspect of robotics that we looked at within the Crystal Ball program was around nursing home and skilled nursing facility. There's a lot of focus on being able to move not only materials around nursing homes and skilled nursing facilities, but also patients themselves. So in the toolkit, we talk a lot about the injuries and the risk that occurs to healthcare workers from having to move patients and to lift patients, and the risk to the patients, from having to be moved and transported. Robotic systems actually provide a way to do this more safely and provide a lot more ability to do this without injuring healthcare providers. So we think that's going to be one of the large growth areas for robotics, is in the movement and transportation of patients within facilities, as well as some more of the kind of mundane movement of materials and products around skilled nursing facilities, nursing homes, and hospitals in general. So when we started the Crystal Ball project, this was an area that was just starting to perk up. But actually, as we've kind of moved through the program, we've actually found that Hearables has actually been one of the major growth areas. We've actually seen a lot of movement in this space. So what issues are we talking about when we talk about hearables? Well, historically, there is a large subset of the population within the United States that need hearing assisted devices that don't have them. And the key elements that really reinforce that, the historic barriers, are the cost of hearing aid devices, the complexity and getting and obtaining ones that actually work and kind of do what you need them to do, and then the stigma around wearing these devices that that look like prosthetic devices that look that are very noticeable and people are aware of them. We've actually seen the ability to actually provide over-the-counter hearing aids, hearing assisted devices that are available without the need for prescription. We've seen technology that's come out that allows better access to more advanced screening, more advanced customization of these tools. The other thing that's happened is that the stigma around a lot of these devices has really become less impactful, in that we're all wearing earbuds, we're all wearing ear pods for a large portion of our day. And a lot of the assisted devices that we are wearing in this Hearables over-the-counter market space look very much like the tools that we're wearing, the devices that we're wearing every day anyway. So the way these look and the ways these function are very similar to a lot of the earbuds and ear pods that are being used by consumers every day kind of across the country. The other thing that really makes these attractive is the ability to use our smartphones and the apps on our smartphones to create custom programming for these devices. So program them to react differently in different environments, to really to tune them to the particular patient that you have. One of the things that one of the topics that came up as we discussed these devices was the potential to use these tools. The ear is actually a great place to collect a lot of the vital signs that we are looking for on a regular basis, including including heart rate, temperature, potentially to cut blood pressure, track movement, head movement, be able to measure skin resistance, galvanic response, things like that. So we're seeing some of these technologies being integrated into these sorts of hearable devices. A lot of the wearable technology, the ability to do a lot of the monitoring we're seeing in the wearable technologies like rings and watches might be able to, we might see more and more of this moved into this hearable market space. And like I said, we've moved through a lot of this really quick. Our toolkit will be up in the next 2 weeks on the telehealthtechnology.org website. But I wanted to leave you with a couple conclusions and then kind of open things up. We want to reopen the poll and just see again, kind of which of these technologies is the most interesting to you, which ones do you think are going to be the most impactful in the next 3 to 5 years, and what would you like to know more about? But as we do that, I want to leave you with a couple kind of key closing thoughts. We all know that the technologies that we're using on a daily basis are rapidly and fundamentally changing. They're not just changing in the technologies themselves, but they're changing kind of how we're delivering care. And we need to change our approaches. We need to change our policies and procedures to kind of match. We think that these technologies will provide better outcomes. We also think that they can do that while reducing costs. AI, we think, is really the one technology that's going to underpin and support all of these use cases that we've described. The growing data sets of biometric and sociological data that we have access to are going to feed a lot of the algorithms that are used, and we're going to be able to draw conclusions. We're going to be able to do interventions that we've not really even imagined before as AI algorithms and data sets improve. We have some real and serious concerns that we want to talk about. The fact that technology is advancing faster than regulation and policy can really keep up. There's a lot of potential uses for technology, but there's not the regulation and policy in place to really make sure that we're delivering the potential of this technology in the safe and effective way that we really need to. As we move in more and more of our care digital into the digital environment, broadband accessibility becomes more and more important. The divides that we already have established around social, economic, racial, cultural, all of the disparities that we see are only going to be increased. Those fault lines are the same around broadband accessibility as they are around those other determinants. And then the importance of digital literacy, making sure that every household, every individual has access to devices and tools and training to be able to use the next generation of tools that we need to deliver the next generation of healthcare. And then around all of that, we talk about these large data sets. We talk about this, all this biometric data that's being collected and owned by organizations and companies in a lot of cases. How do we make sure that that data is secure and private, accessible when we need to access it, but inaccessible to those who shouldn't have it? So we've covered a lot of different topics here. We've covered a lot of different things. The survey result, as we can see there, I think we have more interest in the AI and machine learning than we had before. But again, the telehealth is still one of the big key topics, and we'll definitely do a separate webinar around the next 3 to 5 years in telehealth applications. I do want to take a few minutes here to answer some questions. It looks like we have some that have popped up in the Q&A, and we'll go ahead and take a look at some of these. The first question that came up is, did the work group have any findings related to how national policy may adjust as telehealth continues to expand and develop? Does the group anticipate policy will continue to be dictated state by state? The general consensus is that how we're creating policy and doing it. We need to have a more rapid cycle approach to how we're looking at technologies and how we're addressing some of the policy concerns around them. A lot of this does, United States is different in that we have policies at the state level. But one of the things that we looked at, particularly around apps and some of the emerging technologies, is the role of the FDA in evaluating and analyzing the different technologies that are coming out. There's a lot. We do think that the FDA is going to become more involved in regulating how apps are developed and what apps are available to provide healthcare information at kind of what levels. So there's things that need to be addressed. There's a question about GDPR, which is the privacy rules for Europe. And I can't imagine that we're not going to have some similar regulation and legislation that's not just at the state level as here in the United States, especially as we, again, continue to build these massive data sets, not only at a community level or a national or state level, but just about ourselves. We develop more and more, we wear more and more technology that's tracking more and more of our biometrics. How are we going to protect that? And I do think that will be something that we'll hear a lot more about in the next 3 to 5 years. So there's a question about how advancements are led by large urban organizations, and then how do we think that's going to kind of affect rural and smaller organizations. A lot of the technology changes and a lot of these pilot programs are led by university groups. That tends to be one of the big groups within the United States that kind of drives these innovations and changes. But what we see is that there's a whole market for small rural hospitals. And I think what tends to happen is that large organizations tend to adopt first. They do pilots and they kind of prove the technology. And then we see industry kind of build some of these tools and make them available to smaller organizations. We've seen this with electronic health records. We've seen this with a variety of different software and tools around radiology and critical care and things like that. So I think a lot of these will be available to rural organizations and be more affordable as they kind of get more embedded into kind of how we deliver care. How are some effective ways to improve digital literacy and accessibility at a rate matching the change in development of these technologies? The rate of change is too great. I think we're going to always have a struggle to keep up. I do think we are reaching a point where we're a little bit more able to change with the digital times, but it really that becomes a part of education. I think as important as it was to kind of learn how to balance a checkbook when I was in high school, learning how to manage digital trends as part of our education at every stage of the education process, even for our medical providers. Those are key things that we're going to have to think about and consider. We need to insert those at the educational level, kind of at every level, as managing and improving, and then having targeted education for particular at-risk populations. So for older communities, for communities of color, for urban and rural communities that are generally left out of kind of where the gaps are. I think finding mapping where those gaps are in terms of digital literacy, and then providing education that's targeted for those communities is really, really important. I like this question. Is there growth in the technology industry for development of the caring compassion component delivered in healthcare by all professionals? And I want to stop sharing here. I think this is a good one to end the Q&A on, and then I'll turn it over to Aria. I think COVID really kind of taught us that we can deliver compassionate care using technology, and we can deliver non-compassionate care in person. And I think there are gaps that we need to be aware of, and there are challenges that we need to maybe work a little bit harder at as we're using technology to deliver care. But I think humans interacting with humans, there will always be a need to make sure that we're delivering compassionate care, that we're taking the time to listen, we're taking the time to engage, and that as we do more automation and as we do more, we're using more tools both through and to the right care, that we're not that we're using that technology to create efficiencies that allow better conversations at the right time, rather than offloading as much of the work that much of the hard compassionate work that we have to do. So that's a great question, but I think that what we've seen is we're able to deliver compassionate technology equipped care, and that's part of the healthcare experience. So again, we are out of time. I want to turn it back over to Aria just to kind of wrap things up, but I appreciate you, appreciate this opportunity to talk to you about what the Crystal Ball project was and kind of some of the things that we are looking at in the next 3 to 5 years in telehealth technology.
Thank you, Jordan. Just as a reminder that our next webinar will be held on Thursday, September 21st. That will be hosted by Texla TRC, and that will be on rural West Texas telehealth challenges and opportunities. Registration information is available on the NCTRC website at www.telehealthresourcecenter.org. And lastly, we do ask that you take a few short minutes to complete the survey that will pop up at the conclusion of this webinar. Your feedback is very valuable to us. Thank you again to Jordan for his presentation today, and to the National Telehealth Technology Assessment Center for hosting today's webinar. Have a great day, everyone.